Welcome to Skyscape's free webinar series. Today's topic is Skills Tools, a mobile approach for the nursing student of the 21st century. I am Kristen Snowden-Smith from Skyscape, and I will be the moderator today. This webinar is being recorded and will be available on demand with a copy of the presentation. We will notify you when it is available via email. If you have any questions during the webinar presentation, please post them in the chat. We will have a brief Q&A at the end of the presentation. Our speaker today is Dr. Tim Bristol. Tim is a faculty and student specialist. He works with a number of colleges and universities and resides in Minneapolis, Minnesota. Tim has been utilizing technology in the classroom clinical lab setting for over 20 years. His motto is, "Today we'll learn how to learn." I'll now hand the floor over to Dr. Bristol.
Thank you, Kristen, and thank you everyone joining us live, as well as those joining us via recording. Clinical judgment. I've spoken to most of you in some way, shape, or form over the past couple of years on this topic of clinical judgment. And just a reminder, okay, for those of you that might be newer to the discussion, clinical judgment is the focus of the next generation NCLEX, okay? Remember, NCLEX is changing, and some of the rationale for that change that they give us is 50% of people that pass NCLEX are involved in a medical error shortly after passing NCLEX. Only 11% of our graduates are practice ready when they're evaluated in practice settings, okay? We know that communication is the number 2 need, only second to clinical judgment. And that's interesting because communication is the number 1 reason for medical errors. Okay, so this idea of clinical judgment, as educators, as people in academia, as nurses who teach, we have to remember that clinical judgment has got to become a part of the DNA of our learners. And as a nurse of the previous century, right, what was our motto? Discharge planning begins on admission. That's right, very good. Clinical judgment learning, clinical judgment-based learning, the higher order thinking that is required for clinical judgment, that needs to start day 1 of nursing school. Now, many of you fundamentals instructors are like, Tim, you're nuts. My students don't even, they don't even have their sciences done. How can I have them start moving into this world of clinical judgment? And one of my favorite strategies over the past decades to help promote any type of higher order thinking, especially clinical judgment, is making sure that the student, the learner, is doing patient care every hour of every lecture. They're doing what an actual nurse would be doing while they're involved in the process of learning. Could you write down, wherever you are, whatever you're doing right now, you know, if you're watching this on your phone, or if you're watching this with another group of people or in a classroom, whatever, write down the word doing. The definition of the clinical judgment that is involved in the new clinical judgment measurement model, that definition is clinical judgment is the doing that happens after critical thinking. Doing. You see, when a student is learning something, if they're not learning it in the same way in which they will use that information, if they're not learning it in context, if doing is not a part of their learning, well, Tim, they did the doing last semester. Tim, they listened to lungs in semester 1, and then they all went to clinical 6 different times and listened to lungs then. So now while I'm teaching respiratory in med-surg, they don't need to listen to lungs during my class time. You see, the problem with that is now they're learning some very high level things in your lecture, in your med-surg lecture, but they're not doing. They're just sitting there taking notes. They're just sitting there reading your PowerPoint. They're filling in blanks. They're playing a game. They're having a discussion, but they're not doing patient care. We've got to find ways of helping the student get more and more into the doing and less into the memorization, okay? Many students survived their sciences, right? Anatomy, physiology, micro, chemistry in some programs. They survive their sciences through memorization, so they automatically think that they will survive nursing through memorization. And in many of our programs, they do survive the program with memorization, but you and I both know what that means in practice. That means failure when you're at the bedside. So what we have to do here is find ways of making that doing part of their curriculum. I'd love for you to click in, or if you're watching via recording, you have the luxury of pausing Tim. My wife wishes she had a pause button for me. Pause, he's done for a few minutes. Pause and talk about this. Where in your curriculum do you teach skills? And we do have a poll open and running. Where in your curriculum do you teach skills? Where do your students have those skills labs? In many programs that I taught in up until about, X number of years ago, the skills were all front loaded in the program. More recently, the programs have had skills at multiple locations throughout the program. Where are you in this? All right, can we take a look at those? Let's take a look at those.
Sure.
There's a poll open right now. There we go. How are we doing on that?
So I've shared the results. Can you see them?
I cannot. You could tell us.
Sure. So we have first semester term is 21% of the
Okay,
people
21.
who answered, 14% first half, and 64% all semesters, all terms.
Thank you, Kristen. So this is a really good observation here that skills are showing up, are being taught by a majority of us in all semesters. And I really believe as we go towards this clinical judgment model, okay, as we're trying to move our curricula towards that, I do believe that skills need to show up everywhere, because skills many times encompass that doing. Now I want to walk you through a particular tool that is super powerful yet super accessible in doing this. And that tool is called Skills Hub. Basically, what we're doing with Skills Hub is we're transforming the learning, and I'll start off with the class time, with classroom, with lecture learning, but we'll also talk about lab and clinical. But basically, we're allowing the student to learn in the same way in which they will use the information. So if you're lecturing, for instance, on cellular regulation, cancer, oncology, you fill in the blank, whatever your curriculum uses there, pulling up skills in Skills Hub that are related to that, such as monitoring for pneumonia, monitoring for infection, monitoring for homeostasis in general, right? The skills related to that. I mean, what skill isn't involved in oncology, right? You now are allowing the students to experience the doing while they're studying oncology, cellular regulation, cancer, immunology, whatever, with the immune system, wherever you put that. The students are now able to prepare as if they were providing patient care. The students now are able to go deeper, which when you start peeling back that clinical judgment world, if you will, you're going to see they're going to really need to go deep. In Skills Hub, we have, I think Kristen mentioned, we have 128 skills in Skills Hub. Now, each of these skills comes with multiple phases to the learning experience, and I'm going to show you each of those. So this is the part that lives on the student's phone. Okay. Basically, what they're going to do is they're going to get step-by-step instructions on the skill, gives them a good bit of background on the evidence base for the skill. There's going to be a video for the skill. And then they're going to be able to go into self-assessment, which you're going to be able to monitor as well. How are they doing with that skill? Do they fully understand that skill? So the learning phase of this first, again, picking the skill, what particular skill are they going to be looking at today? What's going on today, and opening that up. So let's say that, again, in class we're covering oncology. Well, there might be personal protective equipment involved in that, right? Especially if they're in reverse isolation. Go ahead and pull this up in your oncology lecture. Now, I realize in many curricula, oncology, cellular regulation, cancer, problems with the immune system are taught later in the curriculum, and we often say things like, oh, they studied PPEs in semester 1, they're good to go. I'm sorry, they're not good to go. And you only have to walk into pretty much any clinical environment in your community, and you'll see that they're not good to go when it comes to donning PPE. And I'm not just talking COVID, I'm talking 2019 as well. I had a friend, my age 24, die of MRSA during a bone marrow transplant. Did he get that MRSA from the community? Nope, because he wasn't in the community. He'd been in our facility for an extended period of time, and somebody gave him MRSA and he died. PPE is not something trivial to say that was covered in first semester. This needs to be covered when Tim's doing an extensive lecture on how to care for these patients. When Tim has an extensive, a tough class time, a tough class period, students call that part of the curriculum. That's tough. Today was really hard because there was so much. I mean, oncology just covers so much. They get a checklist on that particular skill. They get a video of the skill. They get a video that kind of gives them a rundown of what's going on, a good reminder. Remember, this is on their phone. So it's not like videos that live in the lab, that live when you have to get onto a computer and log in, and this is with them always. This is with them always. Then they go into the quizzing area. Here's where they're going to get some of that information. They're going to find out how they did on certain questions. What's that question look like? Now, these questions, usually when I say skills quiz questions, I have faculty thinking, yep, what is step number 1? Yep, what is step number 2? Yep, what do you do? These questions were written in such a way, and take a look at this question, for instance. A child with fever and lethargy. Who is that child? Well, in this day and age, could the child have COVID? Could the child be a child with leukemia? Could the child be, a whole myriad of possibilities, but this is context. So I asked you to write down the word doing. Could you please now write down the word context? Context. When you study the new clinical judgment model from National Council, okay, when you study that new model, you're going to see that layer 4 of the new clinical judgment measurement model that is defining the new NCLEX, layer 4 is called environmental factors, context. When our students memorize how to put on PPE, they are not memorizing in context. They're memorizing a list. That is the lowest level of learning and as far away from higher order thinking as you can get. They're memorizing a list. These quiz questions show them how do you do with context. with those environmental factors, because I'm here to tell you, if you look at the lifespan of NCLEX over the past 30 years, environmental factors layer 4 could be one of the biggest changes we've seen on the NCLEX since it was computerized 30 years ago. Context. Students have got to learn by engaging complex, confusing, chaotic situations just like they're going to in practice. Skills Hub in lab, using Skills Hub as a ticket to lab is a fantastic opportunity to really get the student into the skill. They watch the video, they read through the checklist, they look at the evidence base, they look at the quiz questions. This is a great way to get them up and running. And I'm going to show you the faculty dashboard here in a moment. But it also demonstrates to them, how to prepare for when they have to do these skills. Okay, so today in lab, as these two students are doing, they're dealing with a patient with an NG tube, maybe to suction, maybe, maybe not. Maybe it's a feeding tube. That looks more like a suction tube. And so what you're doing when you require them to use their Skills Hub as a ticket to lab, you're saying to them, this is a great way too to prepare for clinical settings. Students, you're going to want to pull up your Skills Hub before you're with that real patient in that real setting and you have to insert an NG tube. What you're teaching them is how to access evidence-based practice on the fly. If students are only learning skills by using tools that will never be accessible to them in the clinical setting, on the go, on the fly, they're not learning in the same way in which they're going to be doing it. And it's really sad. You could stand in any nurse's station. You could stand in any nurse's station looking at the two computers where they have their micromedics or their list of how to do skills or their, whatever, their learning tools for nurses. You could watch those two computers all day long and not one person would sit down. Not one person would access them. Because many students learned with a bunch of tools and they don't think those tools apply to the clinical setting. Skills Hub is really nice because it's going to always be in their hands. It's always going to be accessible. Anytime they practice a skill, their ticket to lab might be practicing the skill once at home, auscultating a pillow, right? How many of us have had our students go home and auscultate a pillow, right? They can track it. They can come into the app and indicate, I've practiced it this time. They start building their portfolio. It might ask them to access their location so they can track, where was I when I was practicing this skill? The tool allows them to also track when they've practiced the skill or done the skill in a clinical setting as well. As they're doing the skill, as they're tracking it, they can go back to their evidence base, go back to that checklist. How am I doing with this? When they're in lab, when they're in the lab setting, they can also go in and add notes on how that practice went. In the lab setting, they can upload a video of themselves performing that skill. Okay, and all of this is going to show up in the faculty dashboard. So they could upload that video. They could go back and watch themselves. Okay, here's what I did today in lab. They could show that video, or if they have a buddy holding their phone, they could show that video to a buddy, get feedback from that buddy. The idea here is they're constantly in doing mode, in doing mindset. And this video stays with that dashboard. And so they can go back. I mean, remember, there's 128 skills here. Hopefully you're using this across the curriculum. They can go back and look at that video. Oh, wow, I really have improved in developing and delivering a handoff, a shift report, right? With the clinical log that is in this tool, the clinical log can become their portfolio of everything that they're doing in the clinical setting. Now, the clinical log, basically what it has here is a way to document in HIPAA compliant forms, a way to document, what have I done? What has been my experience? Faculty can review these logs. Faculty can provide some feedback. These logs can, the forms in these logs can even be configured based on some of your program outcomes. Maybe your program is implementing a competency-based curriculum and you want some of that verbiage here to match that. Maybe your program is adopting the six steps of the clinical judgment measurement model. And you want your faculty, you want your students to reflect that in their clinical log. You can do that. Faculty can go in and view and approve these logs. Faculty can provide feedback. This is an excellent opportunity for the learners to continuously look back and reflect. How am I doing with clinical judgment? How am I growing in the area of clinical judgment? As you're thinking about ways of getting more and more clinical judgment into your program, you're going to want to track this. You're going to want to have the ability to watch students over time, okay? Watch students across the semesters, watch students. And so when we talk about the faculty dashboard, it's not just, hey, grade this one skill today. It's, hey, these students are in semester 3 and they have 2 more semesters to go. How are they doing? Are they making progress? Are they growing in clinical judgment? Are they really engaged with this doing part of nursing, right? The faculty dashboard is, well, and the dashboard in general is going to help you and the students do a better job of tracking this across the curriculum. How are my students developing and proving it? This portfolio proves to the student that we're making forward progress, that we're growing, that our students are growing. And if you want, you can even use this portfolio dashboard as a portfolio that students can then share with prospective employers. Administratively, you're able to put skills in certain modules if you want. You can manage the students by cohorts. You can assign faculty to cohorts. A lot of power in this dashboard. But I think the real power is looking at the students' progress, looking at these videos across time that students are uploading, signing off, providing feedback, thinking about how the students are growing, or much more effectively identify the students that are struggling, getting that information, getting to them quicker. And you're going to see here in the dashboard, it's very powerful for each particular skill, all 128 of them. Have they practiced it? When did they practice it? How have they done on the quiz questions? Where's that video? Where's their evaluation of themselves or those notes that might go with the video? Lots of opportunities here to give feedback, as well as, if you're doing a lot of students at one time, maybe this time you're only using a drop-down menu to give feedback for their proficiency. And other times you may go into that free text area and provide them something of more depth. From the faculty dashboard, when you look at these videos, you're going to be seeing what they saw, what their phone was used to record, or whatever device that video was captured with. You're going to see that particular view. With this, you're also going to see location. So if they're claiming that I practiced the skill X, Y, and Z, you're going to be able to see, were they in the lab when they did this? What was their location? Or if they're claiming that they did a particular skill in clinical, it should reflect that location of where you would expect them to have been clinically. Clinical judgment requires the learner to build habits. And these habits are not just okay, I have the habit of washing my hands before each clinical experience. And I say just, there's no just before washing your hands. That's crucial. But I'm also talking about building habits of constantly evaluating one's practice, constantly looking at oneself. How am I growing? How am I doing? Building clinical judgment habits requires constant reflection on one's own growth. You're not going to become proficient in clinical judgment if you're sitting around only waiting for an exam from an instructor. Okay, I took the 50-item Unit 2 Med-Surg exam. I'm about to find out how I'm doing with clinical judgment. Oh, yes, you will. But you need to do a lot more self-assessment along the way. The same thing goes for skills. Well, I'm going to wait until week 8 when the instructor has all 92 of us lined up and we go in and we randomly draw a skill out of the hat and they tell us whether or not we passed. No. When you're looking at the dashboard, when the student is looking at the dashboard, they're constantly evaluating themselves. They're evaluating their growth, their progress. They're evaluating their development in the area of clinical judgment. One other tool that I want to mention, and this is really important, when you listen to National Council talk about the research that they've done, the research that they have done related to clinical judgment, related to why do 50% of people that pass the NCLEX commit or are involved in a medical error shortly after passing the NCLEX? Why? Well, they found out that clinical judgment was the #1 need/reason. And they found out that #2 was communication. Now, many times when I'm doing a curriculum consultation, when I'm helping faculty build a new program, when I'm, whatever we're doing, communication gets relegated to one of 2 classes, leadership and capstone in the end, or our mental health instructors. And we say to our mental health instructors, hey, make sure you do that process recording and look for therapeutic communication. And no, communication needs to be showing up daily. There's a tool called Buzz Secure Audio, well, audio and video, if you will. It allows the students securely to start practicing communication professionally. It's HIPAA compliant, it's FERPA compliant, and basically you have a communication tool where your students can start practicing professional communication. How do I communicate securely using technology? How do I communicate professionally using technology? We know that in this day and age, every nurse is going to have to be able to communicate very professionally over technology. And so this particular tool gives you the power to do that. And if you'd like any more information on that, definitely let the people at Skyscape know. They're going to give you some background on that. All right, Kristen, I appreciate everybody again that's here live. If you have any questions and you're not here live, if you're watching recording, we're going to give you an email address to get a hold of us. Definitely send your questions that way. Kristen, do we have any other questions that we might be able to address here? I'm not able to see the chat.
Sure. Question we have here is, what can lab instructors do to help with the clinical judgment for the new NCLEX?
Got it. And I appreciate this question because so many times, anytime I say the word NCLEX, lab instructors are like, oh, this probably is not for me. Well, clinical instructors, do me a favor, do take a look at the sample test items for the new NCLEX. Basically what you're going to see with every single sample test item for the new NCLEX, it's called the next generation NCLEX, using that clinical judgment model, guess what you're going to see? You're going to see a simulation in every single new NCLEX test item. So what this means is clinical instructors, lab instructors, we need your help. We need your help emphasizing clinical judgment principles, emphasizing clinical judgment learning strategies. We need your help, lab instructors, working with us lecture-based instructors, classroom instructors. We need to collaborate. Because when students see a tool like Skills Hub show up both in lecture and lab, the power of that tool in that student's world becomes so much greater. Because it's not just, oh, this is another one of Tim's tricks. Give him a few weeks, it'll go away. No. The value of that tool, the power of that tool, the efficacy of that tool in helping to build the student's clinical judgment is that much greater. So I'm always looking for tools where faculty can use them in multiple settings. So thank you. Thank you for that question.
Thank you, Tim. Another question is, what do I do if the video shown in the app doesn't match my textbook information?
And this is okay, this is a great question. And this goes with any type of tool, software, book, combo, whatever. Hey, I'm sorry, Professor Kristen, step number 8 in the book does not match the video you told us to watch. What's going to be on the exam? What's going to be the correct way to do it? And Professor Kristen has to very carefully and very politically say to the student, look, you've got to find out what are the key principles because of something that we call context. If you ever went to National Council and they were training you on how to write test items, they're going to say things like, write a test item about problems that came up during trach care. Write a test item about being out of supplies. Write a test item about running out of time. They're not going to have you write a test item about what's step number 8 in a particular skill. And if we enable our students by continuing to say, okay, guys, let's just only read this one list because step number 8 is wrong in that video, or step number 8 is not correct in that video, or step number 8 is not how I like it in that video. If we keep enabling our students to think that there is one right, perfect, they're going to fail when they become brand new baby nurses. They're going to fail. They're going to crash and burn. And we're seeing it in epidemic proportions. Students did not learn in context. They just learned by memorizing the proper 32 steps to trach care. And so when they are faced with a patient with a tracheostomy and they don't have the right supplies, they fall apart. And this is an epidemic that is plaguing our profession, and dare I say, is going to cause one of the biggest nursing shortages we've ever experienced, because these new nurses are not going to stick around in this kind of chaos. We've got to help our students learn in context. So if you have a video, sorry, Kristen, you gave me one simple question and I went to Alaska and back. You gave me one simple question. So if we have a video and there's a discrepancy between that video and what's on page 322 in your fundamentals skills book, you need to ask the students which one could happen, which one is reasonable, what are you going to do in each situation? Don't give the students permission to discount one of those situations. They've got to critique both situations and come up with the strengths and the weaknesses in both scenarios, because that is exactly what a professional nurse has to do on a moment-by-moment basis. By the way, I have not said it yet in this presentation, and I need to. Fundamentals Semester 1 Concepts is the most important set of concepts to the work of a new nurse. Period, the end, drop the mic, and walk away. We have over 15 years of research from National Council that demonstrates when they evaluate new nurses in practice, and they've evaluated tens of thousands of new nurses in practice over the past 2 decades. When they evaluate them, it's fundamentals that is at the very top of the list in importance and frequency. Fundamentals instructors, the things that I'm saying right now about clinical judgment apply to you the most. Thank you, Kristen, for that question. Any other questions?
Yes. We have one question is, if a student creates a list with me and I'm using Skills Hub, do they lose their information if the next instructors don't continue with Skills Hub?
Um,
I would say it would be more of an adoption of by the program. I mean, and if the instructor doesn't use it, but once the student has an account, they should be able to access that information through their program. Or
yeah,
at least we
would
don't
have
delete it.
it time, right? It doesn't go away for the student.
No, no,
Correct.
no. So they can build on it.
Correct.
Another question I have is, if you have, which was common, English as a second language student learners, how helpful are these tools for them? Or can they use them?
Yeah, absolutely. So one key important issue with students who are English language learners or ESL is that they constantly are engaging the information from in the same way in which they will experience it in the clinical setting. Let me give you an example. I graduated nursing. This was a different century, so give me a break. But I graduated nursing from a university where I was taught nursing in a very high language level. It was researchers, it was scientists, it was world-renowned professors. Now, when I learned the language of nursing that way, and I got my first job, I kid you not, it was a 60-bed hospital in nowhere, Wisconsin. When I got my first job in that small hospital, do you think the nurses talked that way? Do you think the doctors talked that way? As if everybody had a PhD and everybody was speaking in the language of Synol and ProQuest? No, they did not. They talked in a very different format. So Skills Hub allows the student with ESL, ELL to experience the learning more in line with what's going on at the bedside, as opposed to reading this encyclopedia called a textbook cover to cover and thinking that's exactly the way it's going to sound, look, and feel when I'm standing next to that patient with cellulitis that all of a sudden has a code for no apparent reason. Our students need to learn in the same way in which they will use the information. Skills Hub helps you do that, and that is super important with your ESL, ELL learners. They're going to hear the information more in line with what's happening at the bedside. They still have the evidence base. We present them with the evidence base in Skills Hub. They still get tested with NCLEX style questions in Skills Hub. The videos come from many different parts of America. Many different people talking, so that learner is going to have to listen to many different tones, many different ways of describing things. And this allows them to keep going back to it. So Skills Hub is an excellent opportunity to help those learners learn more realistically.
Plus, with it on their phone, they have it with them all the time to reference.
All the time. Yep.
And we have time for one more question. And let me see here. Do I need to change my lesson plan in class or lab to use this tool?
I would discourage that initially. What I would ask you, if you were to say, hey Tim, we're implementing Skills Hub this spring, I would say, okay, here's what I'd like you to do. Instead of changing your syllabus much more than saying Skills Hub is now part of class, just give it 10 minutes once a week in lecture, where you're like, okay, students, I've been lecturing on oncology now for 45 minutes, or we've been doing activities for 45 minutes. Everybody up out of your chair, grab your phone, open up Skills Hub. I want you to pick at least 3 skills related to what we just lectured on with oncology. And you and a buddy start talking through the checklist for those skills. You start doing some of the practice quiz questions for those skills. If they have earbuds and they can share an earbud with a buddy. Did I say that? That might be a pre-COVID strategy. share an earbud or just listen in, watch a video related to those skills. You see what we're doing? And just give them 10 minutes. Don't give them 30 minutes of your lecture time, your class time. You don't have 30 minutes, but give them 10 minutes to get up out of their chair and address the doing part of taking care of an oncology patient. So don't change your lesson plan. When you're in lab, you've already got your lesson plan and your flow set up for spring. Don't change what skills you're doing this week and this, that, and the other. Just take those Skills Hub type breaks. Okay, hey students, I'm gonna have you pause whatever you're doing right now, open up Skills Hub, see how you're doing with it. Students, when you do your practice, at least one of the 3 practices you do today, I want one of them here in lab recorded by a buddy, and then I want your buddy and you to give yourself feedback in the notes section. Just go ahead and put it hand in glove where you're already at. After you've used it a semester with your current lesson plan and you've seen how you like the different flow and the different way it goes, then you can start thinking about major adjustments. Thank you.
Thank you, Tim.
You bet.
And that concludes our Q&A. You want to advance to the next slide for me?
There we go.
There we go. So for those that have listening attended this, you can go ahead and try out the Skills Hub app for free. It's available in the App Store and Google Play. Just search Skills Hub and you can sample 20 free questions. You can visit skillshub.skyscape.com/#educators, where here you can download a case study of turbocharging your nursing program using Skills Hub and request a trial to view all 128 skills. Next slide, please. Thank you for attending our webinar. If you'd like more information, a demonstration or trial of any of our solutions and savings, go to skillshub.skyscape.com/educators or just to education.skyscape.com. This webinar will be available on demand, as well as all of our free webinars in our series at education.skyscape.com/webinars. And should you think of a question moving forward, or you're listening to this on demand, you can email us at webinar@skyscape.com. Thank you for your time today. This concludes our webinar.